Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. I hope you will make use of it. So today, continuing the subject, we will consider the concept of brain homeostasis and its importance in the implementation of Panchakarma treatment. Now in the brain, as you know, there are two sets of neurotransmitters. One is excitatory neurotransmitter and another one is inhibitory neurotransmitters. The neurotransmitter, that is glutamate, epinephrine, norepinephrine, dopamine, 1, etc. are certain excitatory neurotransmitters. These are basically related with the excitation of the neuron. Whereas GABA, gamma aminobutyric acid, serotonin, etc. are considered as inhibitory neurotransmitter. The neurons which release this neurotransmitter, they will always do the function of inhibition. Neurons which contains neurotransmitter like glutamate, epinephrine, etc., they always do the excitation, initiation of the function. Whereas the inhibitory neurotransmitters also always do the inhibitory function. If something has to be inhibited, then these neurons are get stimulated. If something has to be initiated function, then excitatory neurotransmitters will be released. So motor activity is initiated with the sensory cortex and basal ganglia and cerebellum. We know that any sensation comes, that is carried through the basal ganglia and hypothalamus to the cortex. In the cortex it reaches the sensory cortex. From the sensory cortex information is given to the motor cortex and motor cortex will initiate the function, programming. Now this motor activity is initiated. Now, what is the role of inhibitory? If that motor activity is more than the requirement, or if it is unwanted, or if it has to be modulated, then the inhibitory neurotransmitters will come there and they will release the neurotransmitter and this motor function will be controlled, stopped or modulated according to the requirement. So, excitatory always initiate a particular muscle action, for example, muscle action, and inhibitory neurotransmitters will inhibit that muscle action. After the function is over, that function has to be closed, isn't it? Stopped. So that is a function of a inhibitory. Now in case of CP like conditions, okay, cerebral palsy like condition, what happens? That's a condition where GABA is reduced. GABA is reduced. Gamma and amino, that means inhibitory neurotransmitters are reduced. Okay. Even in seizure, the inhibitory neurotransmitters are reduced. Any epileptic disorders. So what happens? Now there is no balance between the excitatory and inhibitory. Inhibitory is reduced more. So relatively there is increase in the excitatory and as a result the overactivity will be there, and in case of CP this leads to the muscle spasticity because of overactivity of the muscle. Muscle is not stopping at all, it is going on contracting, and in case of seizure it leads to abnormal electrical activity. Okay, so this is because of the overactivity of the excitatory neurotransmitters. Now, take that concept to Ayurveda now. Excitatory is always Vata and inhibitory is always Kapha, because Raja Tesham Pravartakaha, Kapha Niyamakaha. So one which controls, that is called as Kapha, and one which is exciting or that is initiating or Pravartaka, doing the action, so that is Vata. So Vata and Raja is interconnected and Kapha and Tama is interconnected. So when there is Vata Vriddhi or Vata Prakopa, so there will be relative decrease in the Kapha. There will be relative decrease in the Kapha. So relative increase in the excitatory function due to decrease in the inhibitory function. Okay. So there is relative increase in the excitatory function due to decrease in the inhibitory function. So when Kapha is decreased abnormally, there will be abnormal increase in the Vata, controlling the capacity. Therefore, what happens is controlling capacity of the Kapha is get lost. So when Kapha is decreased abnormally, there will be abnormal increase in the Vata. That is, Sthiratva of the Kapha is lost. That leads to loss of controlling capacity of the Kapha. So this relative decrease in inhibitory action leads to increased excitatory activity. Now, what happens in cerebral palsy is due to Dhatukshaya. Okay, Kapha Kshaya is there because of Dhatukshaya, or atrophy or degeneration of the brain. So there will be over functioning of the Vata. That is over functioning of the excitatory neuron transmitters and under functioning of the inhibitory neurotransmitters. So now this actually leads to persistent hypertonicity of the muscle. Okay, so brain motor activity is maintained by two mechanisms. One is excitatory neurotransmitter and another is inhibitory neurotransmitter. Excitatory are, we know that, dopamine, epinephrine, norepinephrine, etc. And this is responsible for motor activities and can be compared with Vata. Okay, same is interpreted as Raja, because Raja is called as Pravartaka. Another mechanism is neurotransmitters in inhibitory neurotransmitters like GABA and serotonin, etc., which control the motor activities by inhibiting when it reaches above the threshold level. This controlling power is called as Kapha, and same is called as Tama. So same is interpreted as Tama, which is nothing but Niyamaka. Okay, so this is the normal, what you say, brain homeostasis. When there is a disturbance of this normal homeostasis, so there will be problem. For example, Raja and Tama, these are the two balancing factor, Vata and Kapha. Now you can ask, what do you mean by Sattva? So Sattva is actually balance of this Raja and Tama. If the balance of Raja and Tama is there, that itself is called as Sattva. Sattva is not another separate entity. If the balance is not there, the Sattva is get affected. It may be Alpa Sattva or Hina Sattva, whatever. So if the balance is there between this Vata and Kapha or Raja and Tama, then the brain function will be normal, and this is referred as normal brain homeostasis. Thank you.